Hi everyone, my name is Jesse Sherrod. I'm with NationalSeniorAdvisors.com, and today we're going to be talking about the benefits of Original Medicare, that is Part A and Part B. So Part A of Original Medicare is commonly referred to as hospital coverage, and Part B is commonly referred to as coverage for doctors and other physician services. This is what is known as Original Medicare, and it is what you are entitled to if you've worked and paid Medicare taxes for at least 40 quarters. You or your spouse has paid Medicare taxes for at least 40 quarters. Your Part A is actually free. So most people do not pay a monthly premium for Part A, and you have to have Part A to get Part B. And Part A comes with some pretty good benefits, actually. Again, it's referred to as hospital coverage, and it comes with, as you can see, in 2017, there is a deductible of $1,316 for each 60-day benefit period. Now, keep in mind, this deductible does go up each year, and along with this deductible, you are responsible for some co-insurance if you exceed a certain number of days in the hospital. And after you've spent up all of your what's called lifetime days, you're responsible for all cost. So it's a pretty good plan in that you have a fairly low deductible compared to other deductibles that are out there, and you have great co-insurance for the first 60 days and pretty good co-insurance for days 61 through 90. But after that, it gets really, really expensive, and there's no limit on the amount of money you can end up spending in the hospital. So even though Part A is pretty good, most people get some sort of supplemental or what's called Advantage plan to fill in the gaps of Part A. So Part B, we can take a look at now. Medicare does not give this one to you for free. For most people, in 2017, the cost right now is $134 a month. And it's paid to Social Security, and it could actually cost more or less depending on how much money you make. But for most people, it's $134 a month. So if you're currently receiving Social Security retirement benefits, this amount is actually taking out of your monthly distribution each month. But if you're not receiving these benefits, you are required to pay this bill on a quarterly basis. Now, in 2017, there's a $183 deductible for Part B, and this amount goes up each year, just like the Part A deductible. And in addition to the deductible, Part B covers only 20%, you pay 20% of the cost for most physician services. So in Part B, we have coverage for things like your primary care, your specialty care, surgeries, lab work, MRIs, urgent care, ambulance, things of that nature. Part B covers. So as you can obviously see with Part A and Part B, again, it's considered Original Medicare. There's gaps in the coverage. You have deductibles, you have co-insurance, and the worst part about it is there's no out-of-pocket maximums. So even though you have pretty good coverage, we call it an 80-20 plan, with a fairly low deductible on both of these, there's no maximum to what you can end up spending. So even with Original Medicare, you could end up spending hundreds of thousands or millions of dollars actually in the case of a very high medical claim. So, there are some things you can do. You can fill in these gaps with either a Medicare Advantage or a Medicare Supplement plan. Medicare Advantage plans, they're also known as Part C. They're private insurance plans by private insurance companies. And with these plans, you actually assign your Original Medicare rights over to a private insurance company, and you would no longer be using your red, white, and blue Medicare card. You would be using the Medicare card the private insurance company gives to you. Now, with a Medicare Supplement plan, these plans are standardized. So, for example, a plan G with company A has to offer the exact same benefits and network of physicians and doctors as company B. So basically, any Medigap, it's also known as Medigap, Medicare supplement plan that is offered, it has to be the same. The only difference can be in the amount it costs you per month. But again, Plan G with Mutual of Omaha is going to be the exact same plan as it is with Cigna or Aetna or Anthem or any of the companies that offer it. It's the same thing. It has to be. It's required by Medicare. The only difference is that premium that you're paying. With Medicare supplement plans, you still use your red, white, and blue original Medicare. And, again, Medicare only allows you to choose one of these to fill in the gaps. You've got to decide if you're going to choose Medicare Advantage or a Medicare supplement plan to fill in these gaps. So if you have any questions about your benefits with original Medicare or how to fill in the gaps that exist, you can give us a call and we can talk to you anytime, Monday through Friday, 8 a.m. to 5 p.m. You can visit our website to learn more about your different options. And again, thank you so much. My name is Jesse Sherrod with National Senior Advisors, and I hope you have a wonderful day.